Are you or someone you know experiencing signs of dementia? Dementia affects our community in multiple ways, and too often we suffer in silence. Caribbean Vibrations TV and Alzheimer's Society of Ontario presents a multi-part series discussing dementia in the Afro-Caribbean community. Moderator Ngozi Iroanyah leads an in-depth discussion with industry experts, caregivers, and healthcare professionals as they share knowledge and insights while highlighting the resources available to support families.
Before we can get any further in discussing how dementia impacts us, we have to understand what it is, where it comes from, and how we can recognize it.
Recognize the signs, break the stigma, support our loved ones.
If you or someone that you know is experiencing signs of dementia, please visit the Alzheimer's Society of Ontario's First Link program.
Welcome, everyone, and thank you for joining us today for this special taping for our two-part series exploring dementia in the Black community in Canada. We are delighted to have some of the leading experts on dementia in the Black community share their brilliant experiences and insights. Cases of dementia in the Black community are projected to rise from 4,800 in 2020 to over 29,700 in 2050. That's an increase of over 507%. This invokes with us a need to address dementia in the Black community and find ways to connect and engage with people suffering from dementia and their care partners. Our moderator for this series will be Ngozi Iroanyah, Director of Health Equity and Access for the Alzheimer's Society of Ontario.
Hi, everyone. My name is Ngozi Faith Onye Iroanyah. I am the daughter of Felix Iroanyah and Adema Iroanyah. And this is my family's story about dementia. It actually began in 1984. My father got into a car accident and he was in a coma for 8 days. And my mother told me that when my father heard my voice, he came out of his coma. The doctor said to my mother, "Be careful. He had his head pretty bad. He might have some challenges later on." My father and I were two sides of the same coin. What he was is who I am. Who I am is what he was. He was an indelible figure. He was this larger-than-life giant. At the same time, he was the most demure man, quiet, composed, and poised. He prized education over everything else. He was classy, sophisticated, worldly. He knew everything about everyone. And he was my best friend. He was my all in all and my everything. The stories he would tell me when I was a little girl, he was the only person in the world that I felt safe with. 2006, he began to behave differently, speaking out of turn, losing his words, behaving erratically. I took him to our doctor, his doctor, and the doctor said to me, "Your father has Alzheimer's." I don't know what that was or what was happening, but I knew that perhaps things would be different. I was working in the hospital at that time, so I'd seen patients who had Alzheimer's, so I kind of knew what was what, but didn't quite understand how it would impact my family. When my father got his diagnosis, I think that's when it hit me. We were sitting at the table, in the dining table at home, and we had the occupational therapist come over. And my father was wondering, who is this white man in our house? What is he doing here? And the occupational therapist said, "Mr. Iroanyah, don't you know you have dementia?" And my father said, "Oh, I see. Will I ever get better?" And the occupational therapist said, "No, I'm sorry, I won't." My father looked down and said, "Oh, I see. Will I ever get better?" And I took my father's hand and I said, "Daddy, no, you won't." And then my father did this. "Oh, I see. Will I ever get better?" And at that moment, I realized our life would begin again. Thank you everyone for joining us, and thank you to our amazing panelists for being with us today. Today we are going to talk about all things dementia, as Alan has stated. And before that, though, I want to introduce to you who our panelists are, these brilliant women who are going to be joining with us on these two-part series. So to my right, we have Dr. Mireille Norris. She's a geriatrician and internist at Sunnybrook Health Sciences Center, also Associate Professor of Medicine with the University of Toronto. To my left is Jennifer Otang. She is an advanced practice nurse as well as a geriatric nurse with the William Osler Health Science Center. And then we have Dr. Onye Nnorom. She is the Black Health Faculty Lead with the Department of Family Medicine and Communities at the University of Toronto and is a family doctor as well. So thank you very much for joining us. Thank you for having us here. First off, I want to start with is understanding what dementia is. Before we can get any further in discussing how dementia impacts us, we have to understand what it is, where it comes from, and how we can recognize it. So I'll ask you, Dr. Norris, please let us know, what is dementia?
So the etymology of dementia means without mind. So we don't want to use that term because we know our loved ones who are losing their cognitive function, they still have a mind. So we've changed the nomenclature, and now we're talking about a syndrome, a neurodegenerative syndrome. So we're losing cognitive function. And for it to be of the dementia magnitude, and we'll use that term just because it just is easier to say that neurodegenerative condition major, it has to factor in a loss in various area of cognition. And it has to be memory, executive function, knowledge, and it can impact mood, but for it to be major, it has to impact social functioning, how we relate to others, occupational function, our ability to carry function daily. And because there are medical conditions and psychiatric conditions and medication that could mimic these cognitive loss, we want to make sure before we say that it is neurodegenerative, that we have excluded those other mimickers, that the person has been, as well as they can be medically, that those losses cannot be explained because of mental illness that is not well controlled, like depression, like bipolar disorder, and that there isn't the confounding of drugs, such as alcohol or other recreational drugs that can also affect thinking.
And what are some signs and symptoms of the early stages of dementia? Because we understand that dementia can come in stages. Maybe you can talk a little bit about what those stages are and what just some signs and symptoms we can be looking out for.
Right. So, I mean, as doctors, we like to put it in bucket of the symptoms that are early. So Alzheimer is the most common form of dementia, and it is more traditionally presents itself with memory problems, language problems, searching for words, not finding the right word. That kind of early pattern is more typical of Alzheimer's. Now, you can have a dementia syndrome where there are what we call vascular risk factors that are really at the forefront. The person had a stroke, had diabetes, high blood pressure not well controlled, high cholesterol level, and in that context of all of those vascular risk factors, what is lost first is the ability to carry function, to walk, to express oneself, and with it, maybe the memory problem are also present, but because what's at the forefront more is the loss of function, the loss of gait, sometimes the memory problem is not as prominent. Or, you know, we don't see it as much as the loss of function and loss of gait, but it's still a kind of dementia.
Yeah.
Now, there are other types where it's not the memory, it's not the language, it's the change of personality that strikes at first. And because it's a change of personality, the person is not acting the way they used to, personality and behavior changes, they will often be seen by the psychiatrist first. And then imaging shows, oh, it's the frontal lobe. So depending on the type and the location in the brain that is struck first, the symptom can be different.
And when you said vascular dementia, it just got me thinking. I know in our community, diabetes, same with high blood pressure, and other comorbidities that can kind of contribute to risk factors for vascular dementia. Frontotemporal dementia, she was describing lastly, can also be found within our community as well, which we'll talk a little bit more about. Thank you for that. I want to just turn to our advanced practice nurse, Jennifer, here. And I want to talk about diagnosis and understanding what dementia is and how we might be able to see it within our loved ones. Let's talk about getting a diagnosis to confirm some suspicions or confirm some behavioral patterns that we see. So Jennifer, can you tell us the importance of an early diagnosis and maybe some preventative measures for dementia?
For sure. In terms of getting a diagnosis, with everything, any sort of chronic condition, it's always better treated when it's done early.
Yes.
So not waiting until the symptoms have progressed to a point where it's late. So it is always important to seek that medical advice as soon as you can. And it's also important to keep in mind some of the contextual factors that are happening right now in the Canadian healthcare system. For many, we have to be in the queue. So we're waiting several months to a year sometimes, and this is because sometimes family doctors, they're sure that we're looking at some sort of memory issue, but they can't quite put a finger on it, and so they would defer to a neurologist or a geriatrician or a psychiatrist even, and so many times it takes a while. So it's always important, as soon as you see some symptoms, to get on it so that you're in the queue and you're not waiting a year from when it's really bad. And of course, once you do get a diagnosis, this obviously opens up opportunities for treatment, both traditional with medicine and alternative, right? Also, in terms of even just community supports, a lot of community supports can't sort of take place unless we have a name of what we're looking at. An early diagnosis also helps with planning for the future, right? And this is important for the individual and family members. And so as soon as we know what it is, it gives us time because, I mean, there are different types of dementia. Some are quickly in progressing, but a lot of the times it's more of a gradual progression. So if we catch it early, it allows people to digest the information, to make important decisions, such as where they're going to live, what sorts of supports they want to have in place. And even within our community, sometimes that's the decision as to, you know, do I want to stay in Canada or can we make plans to go back home? And obviously you want to catch that window because sometimes when people wait too long, then they're no longer able to fly or travel. So again, this is how critical it is, not only for the individual, but for family members. And I would say too, with family members being involved, it also provides them a chance to really know what the individual wants. So if we catch it early, we're still catching them at a time, hopefully where they're still able to communicate their values, their wishes, what they want, so that that burden is not on the family alone. So that you know that, oh my gosh, I'm so happy that we caught it early. Mom told me exactly how she wanted things to play out, and therefore there's not this guilt afterwards, right? In terms of the community resources as well, again, like day programs, there's a short window where people are appropriate for day programs, and that helps, again, to make sure that we're optimizing their quality of life so that they're able to sort of maintain their memory and that sort of thing.
You know, when we look at the research of dementia in the Black population, and we don't have enough research in Canada, so just put that feather in your cap for our next conversation. But from the research that has been done in the US and the UK, Black populations get diagnosed later on in the trajectory of the disease, even though they would have been experiencing it from before. So we have this gap where we're getting dementia earlier, but we're not getting diagnosed till later. Now, we don't have Canadian data as of yet, but we do still see some similar trends. Can you talk a little bit about why there might be some barriers to diagnosis within the Black community?
Yeah, I'm happy to talk about that because barriers to diagnosis will start with ourselves, right? So some of the barriers that exist in our communities, even though they're diverse communities, right? But what we see across the diaspora is often, stigma and silence, right? But with a lot of medical conditions, including dementia, sometimes people are afraid to seek help. Sometimes there's a religious component to it, so they feel like they are being punished, or people will think that they're being punished for something, like, why is this happening? And then family members might also engage in that silencing, or also the reality is it's not just a paranoia about the stigma. Sometimes some family members or community members can reinforce stigma. So I think that's something that, you know, I'm seeing actually having change in a number of different communities, and we're doing that right now, right? So we're having the conversations, and that's what we need to destigmatize. And that's also why I'm talking about my own father and his journey with dementia, right? So I'm bringing that to destigmatize it because it affects so many of us. And it will continue to do so. As we heard, 507% increase means pretty much all of us will either experience it or know somebody, right, over the next few years. What I've seen happen to a lot of patients is, well, first of all, you mentioned in this context, first, it's hard to get a primary care provider, whether that's family doctor or nurse practitioner. So I want to acknowledge that, right? So first entry into the, you know what I mean, trying to access can be difficult. But then when you do have a provider, there can be difficulties with the therapeutic relationship due to biases, right? And these biases are going to be anti-Black forms of racism, whether they're implicit bias or explicit bias. So I don't really dabble in whether or not it was intentional or unintentional, but that is important for the provider to reflect on. But the impact on us as a community or on you as a patient is that it has a negative impact on you. So the bias has hit you, the stereotypes, and so you might have a mistrust of that doctor, so the family might as well. But the other thing is also just having culturally appropriate resources, right? So even if this provider is like doing their best and well-meaning, they might not have the resources on dementia based on like language or culture or just even done in a particular way. Sometimes you can translate things, but it actually doesn't translate culturally, right? And so there are, you know, like multiple layers within the system that the system needs to do better in providing culturally appropriate, culturally affirming care for folks with dementia. But there are multiple, you know, layers to it. I think there's things that patients can do at every level to be able to know more, and that's, again, why we're doing this, so that folks can have that information to navigate better.
You talked about the health systems and the health system navigation for people. In Canada, we don't have a dementia care pathway yet. We haven't developed one, like as we would have for cancer. We have a cancer care Canada, Cancer Care Ontario, with very implicit, explicit pathways that are there for people if you get diagnosed. But with dementia, we don't have that. You kind of get your diagnosis and off you go. And so that can be compounded with but you talked about some of the barriers, you know, anti-Black racism that we experience, as well as some cultural and personal feelings around dementia and getting treatment or diagnosis for that. And I want to quickly talk about risk factors for dementia in the Black community and preventative measures. I think our audience would like to know, what are some risk factors we can think about, and what can we do to sort of maybe prevent or slow down the progression or slow down the onset of dementia that are within our power? Right? So let's talk about some risk factors for dementia.
Yes. So, I mean, there are risk factors that we cannot modify.
Yes.
So our age, gender, genetics can't modify. So we'll focus on those that we can modify. So they've listed some of those risk factors: hypertension, smoking, poor sleep, obesity, decreased hearing, isolation, lack of activity, alcohol, head injury, and I probably covered everything. Maybe I missed a few, but these are very education. You know, so there are intervention where they've tried to actually engage people who had early dementia in activities like exercise, meditation, learning another language, music. You know, when I have patients in front of me, I say, you know, the brain is not just for thinking, the brain is for moving. And we can improve our ability to perform cognitively by doing exercise. We see it for our teenage kids, and you want to improve their performance in school. Right? Similarly, music, learning another language has been associated with doing better in school, but it also awakes the brain. And music in particular stimulates memories, emotions. So when we elicit memories with music, we actually help ignite, areas of the cortex that are put asleep when someone who has dementia is isolated, not stimulated, not challenged, and so if you wait for too long for the dementia to have affected your executive function, then the person has already taken behaviors and habits associated with being hearing impaired. They don't want the noise. They don't want the people. They're fine. They have no problem. Everybody else has a problem.
Yeah, I don't want to hear anyway. I don't want to hear you kids anyway. We're done. Thank you so much. Any other preventative measures or?
What we know for conditions like dementia or diabetes or high blood pressure is that we see it present at younger ages for Black folks, and not just Black folks. We see it often where we see disparities, what we would say health inequities or disparities. And so we have to think, okay, are we all sharing the same mutation, or is it about the situation, right? And so one risk factor that is starting to be recognized is like the stress of racism, right? Yes. Because there's two sides to it. One is, as you mentioned, that adrenal, like that fight or flight that we're experiencing every day, parenting while Black, working while Black, you know what I mean? Just doing
living
all of
while
things.
Black,
Caregiving while Black, living while Black, right? That hypervigilance is there on a chronic level, but also the ways that we might cope with it, right? So the coping you mentioned, alcohol you mentioned, smoking you mentioned, obesity, which would come from high caloric intake, lack of physical activity. I say, to some of my patients, like sometimes just dealing with performing at work is exhausting, right? So,
you go home and and that could also lead to depression and isolation. Correct. All of that stress.
And all of that is so that's part of the stress, because even that dichotomy of like physical health and mental health, the two are actually very much intertwined with the spiritual mixed, in there, right? So you put all of that together. But actually, some of the solutions that you gave, there are so many approaches that happened naturally in our culture, right?
Yes.
You talked about that isolation, but when we come together, right, however somebody might go to the community center or worship, then that's undoing some of that, right? That's preventive. We've got it in our history and you know what I mean, in our ancestry. But doing those things in a way that brings us joy is protective.
Thank you so much, ladies, for your time and your expertise. It's a wonderful conversation. I'm sure our audience has enjoyed it. We'll be taking some audience questions afterwards, but until then, we're going to bring on our next panelist talking about caregiving in the Black community for people living with dementia. Thank you so much, ladies. Thank you.
Thank you.
Thanks for watching Caribbean Vibrations. Follow us on social media at CaribVibeTV or visit our website, CaribbeanVibrationsTV.com. I'm your host and guide, Alan, and we'll see you next time on Caribbean Vibrations.